Hello, I'm Dr. Moira, and welcome to the Daily Doc. We've been talking about hyperbaric oxygen therapy, and today I'm going to talk about HBOT as it relates to cancer. But let's remember that HBOT enhances the amount of oxygen that flows in the blood and maximizes the oxygen that can actually get into the tissue. And so the research shows that there is a growing prominence of the use of hyperbaric oxygen in supportive therapy for patients undergoing chemotherapy, surgery, and radiation. So we know that hyperbaric oxygen accelerates surgical wound healing. It also controls infection. As far as radiation is concerned, hyperbaric oxygen reduces the damage that's caused by the radiation. And oftentimes in chemotherapy, it will enhance an individual's ability to be able to tolerate the chemo. And in some types of chemotherapy, it enhances the effectiveness. So let's talk about radiation, because hyperbaric oxygen is used in a number of different ways. So what happens in radiation and the way that hyperbaric oxygen can enhance its effectiveness is when you think about solid tumors, they really exist and grow and proliferate in a hypoxic environment or an environment where there's a lack of oxygen. So if you bring in hyperbaric oxygen and then have radiation, you're sensitizing the tissues, enhancing reactive oxygen species, which causes damage to DNA and effectively kills more cells. So the idea is to be able to reduce the side effects of radiation, and maybe you don't need as much radiation as was originally thought. And then, following the complete course of radiation that an individual is doing, hyperbaric oxygen can enhance the healing of the mucosa and also effectively treat fatigue. Because you hear many people talk about the incredible fatigue they experience after radiation. And we see radiation used particularly in colorectal cancer, in cervical cancer, and also many other cancers. And one of the things that I am most excited about in terms of hyperbaric oxygen, when we think about its effectiveness with natural therapies, is that it enhances mitochondrial function and immune function. So remember that what cancer cells do is they try to hijack the metabolism of the cell. So we want to strengthen healthy cells. We want to support the immune system. We want to decrease inflammation. And we want to support the ability of the immune system in surveillance. So at Healing Roots, one of the treatments we utilize is mistletoe therapy. And mistletoe is immune stimulating. And when you add hyperbaric oxygen to a treatment that's immune stimulating and it's pro-apoptotic, meaning it kills off the cancer cells, then you've got a much more effective treatment. We also utilize hyperbaric oxygen with high-dose IV vitamin C. And the way high-dose IV vitamin C works is it's pro-oxidant. And so then you're increasing the effectiveness of the ability of IVC to kill off cancer cells and to support the healthy immune cells. Another way hyperbaric oxygen therapy works with immune stimulation is with mushroom therapies and with AHCC. So it enhances the effectiveness of the immune system, which is also being affected by the mushrooms in AHCC. So what becomes important, and the reason you really need to see somebody who understands cancer, is the timing is essential. When do you use hyperbaric oxygen? When is it most effective? And how can it successfully help each individual? The other thing that becomes important in terms of hyperbaric is post-treatment. It can enhance cell counts, and it really supports the healing of the individual. So come check us out. Learn more about the Cancer Healing Program. We have an open house anniversary celebration, patient appreciation on July the 12th from 1 to 3, Healing Roots Center for Transformation at 317 North El Camino Real. So I hope to see you there. Have a great day.